Director of Health and Community Engagement at Piedmont Healthcare, right here in Atlanta, Dr. Jane Morgan. As always, good to see you, Dr. Morgan. So,
good morning, Alex.
How would you define type 1 diabetes? In the glucose monitor, what do we know about it as a disease in total?
And type 1 diabetes is a very specific type of diabetes that often begins in childhood. In fact, mostly it begins in childhood because it is actually a destruction of the beta cells, a type of cell in the pancreas that actually produces insulin.
Okay.
So it's an autoimmune response. It's actually the body attacking itself.
Got it. Okay, so can we put that graphic back up? Because I want to make sure our viewers got to see that. It's a chronic condition. Like you said, pancreas does not make enough insulin. Body is unable to process sugar. Now, that stands out to me because when you look at any food in the grocery store, any boxes, any nutritional labels, you see sugar in it. So is that just not being able to break down pretty much a lot of the things that we eat?
Yeah,
they have a hard time?
Absolutely. And, you know, diet is going to be really important in helping to manage it. And so it's important to have those conversations with your child because often this starts just like Chrissy and John's child at a very young age.
Yeah.
He's only 6 years of age. And so it's important to begin to involve your child in the process because this is going to be a lifelong management and they need to understand healthy habits and important for you to model them as well.
Yeah, which isn't necessarily a bad part of this, right? Is as long as you have that knowledge. But Chrissy Teigen said that she and John, they discovered this diagnosis a separate visit to get blood work done. And that's when doctors said, hey, we're noticing something's a little bit off. So are there any signs or symptoms that parents should really be looking out for? Was there anything that can tell you before even getting this blood work by chance?
Right. I mean, that's a great question, is if parents don't have enough to worry about.
Right.
So things like, you know, does your child seem to be excessively thirsty or very hungry or drinking a lot of fluids all of the time? Or here's a telltale sign. They began to wet the bed after the age beyond bedwetting, or they start to wet the bed again. They start to lose weight. They're irritable. These are all signs that you may be developing this autoimmune disease, type 1 diabetes, which can be caused by viruses or environmental factors, not so much genetics that people really think. Really, 90% of the cases are not genetic. So I really want to emphasize that it's nobody's fault. There was nothing you could have done to prevent it. There's nothing you could do to delay it. It is some combination of factors that we still don't quite understand where your body begins to attack itself.
That is so, because that was my next question actually, because you hear so much of, you know, I'm more susceptible to X because of, you know, a familial situation there. So if that's the case then, so when you talk about healthy eating, as the kid gets older, exercise, does that play a role in it as well? Does that help or hurt?
It really does. Exercise plays a role. You really want to begin to develop these healthy habits, and it's all lifestyle because this is going to be how you manage your life forever. This will be a lifelong disease. So far, knock on wood, maybe science is going to develop a cure for it.
So,
yeah, that would be great. But currently, this is going to be, you know, management. And what you need to do is sit down with your child because it's generally a child. They're very young, a calm, comfortable environment, and then explain to them about diabetes in a language and words that are age appropriate for their level of comprehension, and try to make certain that you don't over-educate, right? That you just stick to the basics. What diabetes is, why it's important to manage it, involve them in the process, and don't try to get too much done in one sitting. Don't over-educate. You can educate over time, small bits of information, and let your child begin to internalize it. And you need to also be positive and begin to model healthy behaviors as well. This is good for the whole family to make certain that you're eating well and that you're exercising as well.
Yeah. All right, Dr. Morgan, thank you so much for breaking that down because it did catch a lot of attention. We were like, wait a minute, he's so little. You never know, but thank you for all that information and insight. All right, we'll be right back after a quick break.